Our first speaker, Dr. Dee Eddington, is a professor in the School of Kinesiology at the University of Michigan, director of Health Management Research Center, and a research scientist in the School of Public Health. In addition to his research and teaching, he has spent the past 25 years in academic administration. Dr. Eddington's research has focused on the precursors of disease and vitality, and he has long been interested in how health promotion, work-site wellness activities, and programs within our organizations impact healthcare cost containment, productivity, and human resource development. Author of many articles, presentations, and several books, including the one at your place setting, Zero Trends, Health as a Serious Economic Strategy, Dr. Eddington is a renowned expert in the field of wellness. Please welcome Dr. Dee Eddington.
Thanks, everyone. Pat and Jerry, everyone else. It's a good group. Hope you all can see the slides. It doesn't make a difference anyway. The important thing is not what's on my slides or not what I say, but what goes through your head in this time. And now if you're thinking about lunch, that's probably not a good thing, but if you're thinking creatively about what can you do in your organization to improve the workplace and the workforce. We made a major mistake in this country by focusing on the workforce and sort of ignored the workplace. And so it's time to stop this nonsense and start working on the workplace as well. So my job is to irritate people, and I'm pretty good at it. Get all my electronics done here. So if we get close to the end and you haven't been irritated, raise your hand and tell me who you work for, and there's enough irritation in healthcare to go around, so no one probably has got it right by themselves. Okay, this is what we're about, and this is our house in Ann Arbor, right in the middle of the campus. And if you get around Ann Arbor, you want to come by and stop for coffee, that's okay. If you need cream and sugar, bring your own. We just drink it black. These are the people that work in the center. There are 34 people that work there. 4 people work off-site, 1 in Singapore and South Carolina, and 2 in outstate Michigan. And we hire physics majors and math majors because they know how to deal with large sets of numbers. And I show up not every day, but some days for lunch and so forth. And just to get an download from what they've done during that week. These are the companies that we work with. We work with large companies primarily because that's where the data are. We have several in Wisconsin. We Energies is one of the places. Wisconsin Education Association, they're an honorary now. They learn so much they can do it on their own now, so that's good. Affinity Health System, Appleton, they do the same thing. So we work with large companies because that's where the data are. But the interesting thing is, how can we bring it down to small, medium-sized companies? Because that's where I think the real advantage is. In wellness, small, medium-sized companies can get more out of this than large companies, and it's easier, and you get the return much quicker. Because if you have a company of 10 people, both hands, you have a company of 10 people, and one person goes down, that's 10% of your workforce. So you have more of an advantage to keep everyone as healthy and as high-performing as possible. Also, I don't think this is about health anymore. I think we're past that. It's about economics. That's why the title of the book is about economics. I don't think business really cares about health. I think you care about economics and profit and performance. So let's just talk about performance, really, rather than health. The health is a big indicator of performance, so we got to do both. All right, today we're going to get about getting serious about a health strategy. I think that's a good title. It's about time we started to get serious about it rather than just a sort of a fluff thing. I'm going to talk about the natural flow, what happens if you do nothing, because that's very critical. Many people say, well, why, I'm just not going to do what you suggest. And I said, that's fine, just do nothing. You know, that's your business. So we spent a lot of time doing that because I think that's the basis of all of our analysis. We don't do ROI studies. I think they're all biased. I think you should throw them all out. And anyway, all get 3, so what the hell, just call it 3 and forget it. Business case, talk about the business case. We've spent 20 years doing the business case. And then I'll talk about the mission. What is the mission now? The mission has changed the conversation from health and disability as a healthcare strategy to a business strategy. And then I'll give you the solution that we came up with in the last 4 years. All right, the first one's current strategy is natural flow. The natural flow of an American, just wait for disease and then treat the disease. That's what America healthcare does. By the way, the slides, you can have all these slides. Bobby, you here? Is Bobby here someplace? Where? She will be here. So she's not here. Okay. She's in the room. How are you going to get the slides if we don't know where Bobby is? Okay. When she gets here, remind me. Thanks, man. Wait for disease and then treat. That's what America does. And in quality terms, I think it's a quality issue. All medicine does is wait for defects and then try to fix defects. That's the medical model. And that's what we do. Sickness care. And we all know that. So. But I'm going to come back to that because that's a very serious learning. And I'll tell you why when we get ready for that third. Why that almost drove zero trends. And here's the typical risk factors that one looks at in a health risk appraisal. You know, the typical ones that we look at. We don't believe individual risk factors or individual diseases. We think that's probably failed. Both of those are failed strategies. But we look at the combination. What's the low risk, medium risk, and high risk? That's the simplest way. There's a much more complicated way that we look at it. But the simplest way is just count. How many risk factors do you have? And so today, make up your mind. You want to be low risk, medium risk, or high risk. It doesn't make a difference what you pick. Just pick one. Hopefully it's low risk. And today, 64% of this group would be low risk about. It varies from risk to low. The lowest we've seen is 45%, and the highest is 75%. So someplace in between there. 64 is a reasonable number today, and 11% are high risk. In 3 years, if you do nothing in America, just live a good old American life, 61% will be low risk, and 12% will be high risk. So you can't do anything with those data. You can hyperventilate. That's about all you can do. Something useless like CDC would send you. You can't do anything about it. Just there it is. Then you make up all kinds of stories why. That's trying to explain it. But CDC doesn't do longitudinal work. That's what we do. We know where people go. So interestingly, what happened to the people? 78%, 77.8% of the people will stay low risk from 1 year to the next, for over a 3-year period or a 5-year period, or from one administration to another administration of a health risk appraisal. I call those the champions of America. What does healthcare do for those people, or health promotion do for those people? Nothing. Zero. Because neither one, medical or health promotion, can make any money on those people. Yet those are the champions. Where else in your businesses do you ignore your champions? Is there any place else in business you ignore your champions? I don't think so. You wouldn't be very successful very long. But your champions are what drives your profit. So over the 3 years, some people got better, and some people got worse. That's the Markov chain, the first order Markov chain. The actual solution is the second order, but I'm showing you the first order. Where you are today is determined to a lot by where you were last year, and actually the year before it as well.